indeed for joining us and welcome to the program.
Thank you very much for having me. Good morning.
Perhaps we can begin by asking what are the top priorities that WHO hopes that this meeting might deliver on by its conclusion, and how will those outcomes translate into change on the ground?
Thank you very much for that question. For us, there are some key things we hope to get out of this meeting. One would be for countries to talk through and share amongst themselves the challenges being faced, what each of them is currently doing. I mean, we have countries coming from across different parts of Africa. Then we also would want countries to understand what is available, what are the policy options that they can take to make a difference in responding to the really challenging times that we are in, but also to understand what instruments and what support and facilities are available from different partners to complement their own domestic public financing in driving access to health. And largely, we hope to build a community of people, policymakers, technicians across the continent who will continue to dialogue and to solve the problems that we foresee we will continue to face moving forward, but to find practical ways of dealing with them, learning from each other all along the way. So these are some of the, concrete outcomes we hope to come out. But and finally, one of the key things is that each country, as they live here, will be able to go away with a very clear idea of at least one thing or one or two partners that they can work with moving forward to take forward what they are currently doing in their countries, and who will be able to support and work with them along the way. Over.
You talked there about domestic financing, and we hear that many African countries still rely heavily on external aid. I wonder how realistic it is for them to shift towards greater domestic financing, given the current fiscal conditions and constraints a lot of these countries are facing.
Thanks for that question. It's really, I think this is the crux of what we are all grappling with, of course, in our countries, or in our region. Several of the countries are, as you know, classified as lower middle income countries or low income countries, and often may not find it easy to quickly mobilize or to fully finance health from their domestic resources. Having said that, I think the key thing is having the commitment to health, to see health as the real investment that it is, and whatever a country can do. I mean, I think if one country can make progress in increasing progressively, no matter how small you're adding each year, it makes a key difference. And then added to that, when there is that commitment and that leadership from a country, then where you still have external sources coming to you, there are still countries that are receiving grants. We know there is reduction from some donors, mainly bilateral, but we also know that some external financing remains available to countries. And so making all of those work together more effectively, more efficiently becomes even more critical. Countries have, endorsed the Lusaka agenda to align to work with partners and for partners to align to their national priorities. And if we can at least move towards making that, operationalizing it, making it a reality for countries, I think it makes a huge difference in supplementing their domestic resources. Where even if it's not entirely there, coming from domestic pockets, where external funds are able to flow through national systems or align with what the government has set out in its strategies to do, then it works and functions as well as their domestic resources, while giving space and time for countries to slowly build up to where they need to be. But as I said, it doesn't take away from the need for our countries, governments to commit to making that increase, even if it's a little bit a day. Over.
I wonder which types of innovative financing mechanisms, for example, levies, maybe even bonds, blended finance, show the most promise in the African context. And what evidence do we have that's pointing us in a particular direction?
Thanks. In difficult times, we try out some of, all that is available. On the one hand, I will say things like the health taxes, the levies, have proven already very effective in health. Many countries, not just in Africa, but across the world, have levied different, degrees of taxes on tobacco, on alcohol, and even on sugar-sweetened beverages and other kinds of products. And these have generated revenues that we know they've been successful in generating revenue for countries. In some cases, some of these have, been able to be reverted back to the health sector to support. But conversely, they have also over time supported in reducing or ameliorating the use of these products. For some of the other instruments, the debt conversion for health, even using the social impact bonds, these are largely still being tried out, I would say, to a smaller degree in the health sector, but we know that they've been used elsewhere and have worked. The debt conversion, I mean, we do know where it's been. Our partners, the Global Fund, have supported some of this and been able to release some of that funds to go back to the countries to be reinvested in the health sector. And I think in the few countries where that has happened, we've seen some success with it. And for the social impact bonds, granted, some of these are still a few programs that are being implemented in a few countries, one of which I think is going on in South Africa. There's another in Kenya. But we think they're showing promise. They have not been going on for very long, but we do see that they show some promise for countries in being able to crowd in other resources, because the key thing there is where the government cannot do this entirely by themselves, then you're having these instruments that allow others to co-invest with you in a way that is less risky for all and yet allows the government to achieve their goals. And so in terms of helping the countries to crowd in resources towards achieving health goals, I think that we are seeing good results there, and we'll have to see over the longer term how sustainable these can be. But I think there is room for optimism here. Over.
How can partner alignment and coordination be improved, do you think, so that multiple funders don't pull countries in different directions or even duplicate efforts?
The it seems a little bit simplistic to say this, but a lot of this starts from the leadership of our governments themselves, our policymakers, and a clear sense of direction and outlining of what the national priorities for health are. In Without this as a very, very strong basis, we find that it's even more difficult to get partners to align to work together towards that common goal. When anyone brings funding to a country, inherently they're likely to be other interests, or for some of them, they are set up to support very specific mechanisms. But being able to work in a complementary manner helps when there is a clear plan and a clear strategic direction for the country. And then you can then work with the partners to agree on which areas that they can support in complementarity to the domestic resources. But where governments aren't clear about the direction they're going, or where there is a sense of dissent within. If you have different parts of our government going in different directions, then it's also easy for different partners to kind of drag everyone off in all of those different directions without being able to come together. So as simplistic as it sounds, I think it's extremely difficult to move towards partner alignment, partner harmonization, where the recipient government itself is not able to demonstrate its clear vision and to show the leadership in saying to partners, we need you to align to a vision, or, perhaps this is not the best place for you to work. But for all of the partners, within the region globally, there continue to be the dialogue to move better towards what countries can, what countries want, what countries have planned to do. But as I said, that all of those efforts can help and can support, but in the end, there's really no substitute for a country that knows exactly where it's going, and it's simply looking for the support to be able to get there, rather than the country that is being led by the different priorities of the partners. Over.
All right, that's where we're going to have to leave it. Unfortunately, we've run out of time, but thank you very, very much indeed for joining us. And we certainly wish you the best of luck with the deliberations this week.
Thank you very much. And again, happy to be here.
That's